Welcome everyone to another edition of Nurses Talking. I am Dale Barzey. I am the host of this channel. On this channel, we speak with nurses all across the spectrum, from student nurses to retired nurses in every discipline. And my guest today is Mrs. Margaret Ewen, who is a registered nurse and with public health being her specialty and education. So welcome, Mrs. Ewen. How are you?
I am just wonderful.
Okay. Thank you for agreeing to speak with me today and for sharing some of your experiences. I know you have a lot. I looked at your resume. You've done so much. You've educated, you're a public health nurse. You've done immunization management and epidemiology. And, I'm just anxious to hear all about your experiences in this wide and beautiful field of yours. But first,
Yes.
I'd like to know how you became a nurse.
Well, I first became a nurse because my mom was the one that inspired me. When I was younger, my mom and dad, when they needed a back rub, they will call me to give them a back rub. And my mom said, your hands feel like a nurse. So that's where it all started. But it really, where I got the confirmation is I used to love just going to visit the hospital, Glendon Hospital in Montserrat, and saw that I really enjoy just not seeing anybody that I know particularly, but just going up and visit at the hospital, at the pediatric wing. And then later that really confirmed the nurses would take me under their wings and I would shadow them, get a little feel of it. And so that's when I knew. A lot of people didn't like the hospital. They didn't like the smell of it, but it never bothered me. So really when I saw that, I felt very comfortable with just going and visiting patients, following the nurses. And I knew that's really what I wanted to do.
So, that's an interesting thing that you're saying, because I'm thinking as you're saying that today, I don't know of anyone who could actually just walk into a hospital and say to a nurse, I want to follow you around. and that happens, And I realized that you're speaking of Montserrat, which is a really small community, and I'm sure, and everyone probably knew you anyway. But still,
Yes.
it's that's a whole different concept, a whole different thing that you could just go and follow them around and just see what they're doing.
Mm-hmm. And interestingly, when you talk to high school students that's maybe thinking of going into nursing, but they're not sure. That's kind of one of the things that I would say. Volunteer. You can sign up to volunteer at a hospital, and you really get to know whether that is something that you would want to pursue.
So after Montserrat, what did you do?
So my family moved here to the United States in 1969, and I knew that's where my pursuit was, to go into nursing school. So after getting to the United States, looking at how we would go about that. But my first job, as to get your green card, you have to have jobs already lined up for you. So my first job was with a nursing home, and as a nursing assistant, and I really hated it. I did not.
That's a hard job.
It is working with, and I think it wasn't so much the patients why I hated it. It's you're left alone, and the patients needed assistance, and you couldn't do it by yourself because you needed somebody to help you to get them up or to move them, get them. You couldn't do it all, and you couldn't find anybody. They all disappear. So I like to treat people as I would love to be treated. So I would want to give them, nice, good, tender care with love and make them feel, some of them, are really nasty towards you, but you have to be patient with them. And that's when I realized no, not this.
This is not for you.
It really only lasted 2 weeks. But I had an aunt who was working at Boston Children's Hospital. and she got me in. I got an interview and they hired me. At that time, which was in 1969, during that time, nursing assistants were hired on by the hospitals and they are trained by the hospital. So they had classes, you go to classroom training, and then you had the bedside training. So I learned my basic nursing skills there. And I love pediatrics. I loved that. Then I realized, there's another side of nursing and with that. And so the pediatric side, I worked 2 years while, looking at the schools and learning the system there before I applied to nursing schools. And I selected Boston College as one of the schools. Well, they gave me a little bit more money than the other schools, so I selected the one that gave me the most money.
Yes.
And then I went to Boston College in 1971 and graduated in 1975.
Okay. So that was a 4-year program.
Yes.
Okay.
And interestingly, during that period of time, as you know, nursing had been going through changes. So the 3-year programs, which the hospitals had their nursing programs, which were 3 years, and you got a diploma, those were being phased out. The LPN programs were being phased out. Nursing was going the route of the baccalaureate programs. So that's, my class was actually one of the first in that new phase of baccalaureate degrees. So.
Okay. So having done that, then, did you work as a nurse in Boston?
I did. After graduating, I went back to the Boston Children's Hospital, where I worked as a nursing assistant. I went back and worked there for 2 years. 2 years is really all. The reason why I only asked, I love pediatric. When I went into school, I basically said, I'll find out which area of nursing that would be what I would want to pursue and work. I found that pediatrics and public health, community public health, were the 2 areas that I loved the most. So after school, I went back to Boston Children's Hospital. But the reason why I only lasted 2 years with them is because you had shift changes. Back then, you had to work all 3 shifts.
Yes.
So you're changing shifts, and you're also having to work weekends and the holidays. And the rest of my family and friends are all off on the weekends and the holidays, and when everybody is off doing fun things, I'm on my way to work, which I hated. I hated the night shift most of all. I hated doing the night shift. It was, they call it the graveyard shift. Well, I hated that part of it. So I did not like that whole change. And I just basically told them, I'm leaving. I'm going to find a 9-to-5 job. They kind of laughed at me, but as I left there, shortly after, somebody told me about school nursing.
Okay.
And so I went down and applied for the Boston Public Schools and applied there. And they hired me as a substitute nurse. So I was working really full time, but as a substitute without the benefits. Because, and they loved me so much that they wanted to keep me on. And I worked the summer for them as a summer nurse. For the schools.
Summer school.
And typically those positions are given to those with seniority. But they didn't want to lose me, so they basically gave it after that to me, and then I was hired full time with them the following school year. From there, I worked 4 years as a nurse with the Boston schools.
School system.
And the only reason why I kind of wanted to move on is because there was not much of upward
No, no
climb in
upward
that,
mobility. Okay.
yeah. So I was looking, you kind of got used to doing the same routine, and you want to move up.
Yeah.
So I wasn't at the end of my career. I was more at the beginning of my career. So I needed to move up, move
Yes.
on, get new things. But I learned a lot from that. I realized that really the public health piece of it, which school health nursing is kind of public health as well.
Yes.
So that really made me figure what area that I wanted to pursue a little bit more. So I from there, I went and applied to Tufts University for their public health programs. So I got my master's in public health from Tufts University. And from there on, my career went on in public health. But one of the things I want to say is that the one thing that helps you decide where you want to go with your career, what area is after you start working. Because when I was in school in my senior year, I knew I wanted to go on and do my master's, but it was going to be as a pediatric nurse practitioner. And if I had gone straight on, that's what I would have done. And that really wasn't my full interest. I know I love pediatrics, but I wanted to be the pediatric nurse practitioner. But after working is where my public health interests really developed.
Blossom, yes. Okay. So then you worked in public health in the Northeast still?
I worked in public health after graduating from Tufts. I sent my resume to the epidemiology department, which was through at the Boston City Hospital. That's where the public health epidemiology. But when they saw that I was a nurse, they just forwarded my application down to the nursing department.
Okay.
So, which I didn't know a whole lot about, that they had that kind of a program, but I knew I wanted something in public health.
Yeah.
And epidemiology was one of the areas that was most intriguing to me. So from there, I got a call for an interview and they hired me on as a public health nurse. We, at that point, what we were doing is following mothers, pregnant women, and infants. So we will get referrals. There's a screening that's done, and they will screen out those who are at higher risk and refer them to the public health nurse. And also for the infants, we would get failure to thrive referrals, we'll get newborns. But if we start following them prenatally, and there were studies being done throughout that time where that to see what was the best way to improve the outcomes of infants. Because even still to this day, the United States is still one of the highest rates of infant mortality
and
so
morbidity.
Always ways trying to get. So that's where the public health nurse came in. We went to their homes. We got the referrals from their doctor's offices, clinics, and then we saw them at home. And the idea was to do education, making the assessment and education, and following them and giving them referrals that would help wherever the need is to make sure that we have a healthy pregnancy. And also that there is a good outcome for the baby as well. After the mother delivers, we then follow her, up to a year, 2 years if need be, that we will follow her. So we do an infant assessment, a physical assessment. We do a home environmental assessment. In some cases, the hospital will not discharge the baby unless they have an assessment of the home, because they feel there's something there that they're not sure that they can send this baby to. So the public health nurse will do a home visit and make an assessment and make sure that the mother has everything that she needs to bring this baby home. And
safe
that's what we'll do.
Okay.
So lot of education is what is done by public health nurses. So we follow them and reinforce some of the things that we would teach, and we hook them into resources in the community that can help them as well. We used to see a lot of teen moms, you know, so
Yeah.
the rates of teen pregnancy have reduced over the years since a lot of these programs have been implemented. But that was the fun part of the public health experience, doing, you know, that, seeing people and making a difference in somebody's life. It's not always that you get 100% compliance. And sometimes you can burn yourself out trying to help people that don't seem like they want the
They don't want the help,
so,
yes.
So you do your best, and then those that you can make a difference, that's what makes you go on to do what you do.
Yeah. Yes, indeed. Yes, indeed. So as you were talking, you mentioned epidemiology quite a bit. So tell us what that's about.
So epidemiology is, like they said, disease detectives. You are trying to find where the source of a disease came from. Certain disease like that can spread. For example, this pandemic that we're in, it's a lot of epidemiological studies that are being done to help reduce the spread. And that's why you see in the beginning of this pandemic, masks and that kind of thing was not being pushed. But as they learn more about the disease, and that's how the epidemiology actually learn what this virus is doing and how can we stop the spread of it. So even with the mask, and people have really gotten off on this thing as it's not necessary, but it's one of the ways before a vaccine comes out that we know that can help reduce the spread of the virus. So epidemiology, you're basically is learning a disease, a virus, a bacteria that can cause harm and can be passed from one person to the next, that can spread. So you're trying to identify where is the source, and then intervene to stop the spread. For example, TB. You don't hear a lot of people dying of TB, okay? Because once you get a case, you're on it. The epidemiologists do their investigations, they find out the source, who their contacts they were, and now that there's treatments, give prophylactic treatments to those who could possibly come down with it. With this pandemic that we're in now, it's a new virus, and it's very deadly, very deadly. So you would have had to be on top of it from day one when it first, to be able to stop it from spreading all over the world. And that wasn't done. So a lot of things that allow that virus to get loose and go across the world. And that's what we're dealing with now.
So listening to you speak about it, I can feel your excitement about epidemiology, and I know why you would have sent your resume to the epidemiology department.
Yes, exactly. When you learn this in school and you see that, wow, this is so interesting. You can actually stop the spread of a disease to harm a whole community, a whole country. But you have to be on top of it early enough to be able to identify it. And then, yes, we know we were planning on pandemics happening, for years, that this could potentially happen. And a previous administration had saw that could be a potential and put in place, things that can help identify it early and then to stop that spread. There were other if you remember SARS, if you remember even Ebola, that could have gone on to spread worse than it did. The H1N1 flu was another that could have really devastated, even though a lot of people, once they identified it, it didn't come during the time, a typical time that flu will happen. But once they saw that it was a flu virus, then they know how to make the vaccine for flu. So that was not that difficult as this particular pandemic to be able to just go ahead and stop the regular flu that was coming out and put that virus in the vaccine so that they can go ahead and once we started vaccinating people, you saw that it died down, went away. Now that particular virus is in the vaccines now, so that we can control that flu.
Yes, indeed. So other than epidemiology and the epidemiology piece of it, tell me about your public health day.
So several years ago, I was here in Tampa. When I left Boston in '85 after getting married and moving here to Tampa, that's what I knew I was going to do, public health. And a few years ago, one of the local newspaper wanted to follow a public health nurse, and they selected me to follow a public health nurse to say, what is the day in the life of a public health nurse? So they followed me to do a home visit where I saw our young mom that had just had her baby, and I did the infant assessment, the postpartum assessment, gave her some education, made sure that she had the resources that she would need so that would have a healthy baby. And with that, we don't just do the one visit. We are going to come back again, maybe weekly. It could be bi-weekly based on our first assessment. So you can go out and make sure that things are going well. If you saw that this baby, you had a little bit of a concern, and sometimes even with the mom postpartum, recently I've heard several healthy women that died after postpartum complications that can happen. So that's one of the things you can pick up a lot of times early once you're there and make sure that they go in and get the assistance that they need. If not, there are several postpartum cases that I've had that could have ended up being really disastrous. So with the public health nurse doing those home visits was so critical, especially for those that don't have the resources or don't know how to, or don't know don't know how to access the system, don't know what things that are abnormal, kind of thing. People don't speak up. So you're educating them on that. So with that piece of it, the home visit, there are other areas in public health that we do as well. So I've done, working with the epidemiology department, working in that area. What the public health nurse will be doing is making an assessment of any disease, reportable diseases. So labs, hospitals, doctors' offices have to report a certain diseases to the health department, and the epidemiology takes on. So we had a TB department will only take the TB cases because that's a high specialty and requires a lot more intense. Then you had the STD, that's a whole department by itself that does that, and the HIV, that's another. So but the other reportable diseases such as measles, mumps, what you call hepatitis A, chicken pox, hepatitis B, those others, the epidemiology department actually does the investigation and follow up on those. And those diseases that there is a vaccine for, then we're making sure that first you have to assess, were they ever vaccinated? Where did they get that from? Sometimes it comes from travel. And that's why we have travel clinics, so that before you travel to certain countries, you should go and get vaccinated for diseases that would be more prevalent there.
Yeah.
So that's kind of what epidemiology really does, to really identify where did that come from and who are your close contacts, household contacts, work contacts, that kind of thing, so that they can get the protection before it spreads further.
Yeah.
At times we have to contact the hospital. Sometimes a patient is hospitalized and we have to get information from that patient. So we may have to actually go visit the patient in the hospital to get those contact information. Yeah. If we can get it from the hospital, like they have disease specialists, each hospital that would get the information for us so that we don't have to do that home visit, that hospital visit rather. But we may have to do a home visit, at times where to go and see the patient to get, if you can get it by phone and do that, but some diseases you don't want to sit on. Hepatitis A, you don't want to sit on.
Right.
You don't. Chicken pox, if they're a child at chicken pox, the schools are involved. So we have to get all of those kids that are not vaccinated, that are in contact, out of the school. And make sure that they're getting protected. So it's a lot to public health because there's so many different areas. The immunization, my last position with the health department here was with the immunization program. I was the immunization program manager, where we basically all kinds of vaccines, travel vaccines, adult vaccines, childhood vaccines, all vaccines that are licensed in the United States, we carry. And so we can give those out. Make sure children are being vaccinated. Their requirements in each state has their requirements, pretty much following the CDC guidelines. But that's how we get kids vaccinated and protected. And you have those that don't like vaccines.
I know. I get
that. You still have to educate them.
Yes.
You still have to educate them.
Yes, because people need to be able to make an informed decision. It doesn't mean that they're going to change anything, but at least they'll have the information. So I have a question now about your public health, because since the delivery of healthcare has become focused or less focused on acute care, in that acute care stays are getting shorter and shorter. That in a way is a desirable thing. But how does that impact you as a public health nurse? Because now it seems to me that stuff that would have been done when I had my son, I stayed in the hospital for 7 days. I was in the hospital for 7 days. I don't know anybody who's in the hospital postnatally for 7 days.
For 7 days, not now.
How does that impact your job?
So what most public health does not really, public health nurses are not there for the other kinds of, like, people that had surgeries or, they have the Visiting Nurse Association, and they have other home health nurses for that. So public health doesn't do that. But years ago, long years ago, before they had all those, public health did all of those. The public health nurses were covering everything. And then that changed over the years, where they had home health nursing to do those kind of things. As the hospital, the visits, the hospital stay post-surgery, it gets shorter and shorter. Then they're sending people home earlier. So that's where home health nurses came into play. The public health nurses more went towards the more healthy, like
You're more
the
education and
pregnant.
preventative.
Yes, the preventative part of the home visits that were done that way.
Yeah.
So that's where most of that, even though even the public health nursing programs have changed over the years,
Okay.
that they're not doing as I did. You know, they're not doing having nurses go out. They actually are training non-professional people to go out and do those kinds of visits. And they may have one nurse for a team that if there is a medical that they can come back and talk to the nurse, but it wasn't the nurse like what we used to do that did all of that. Went out and you be able to do the nursing assessment. Now they're training non-professionals and have them go in their home. So they're looking more at the social.
It's from a social model rather than a medical model.
Exactly.
Okay. The question I was going to ask you just slipped from my mind. It will come back. It will most certainly come back. But I know what it is I was going to ask you. I was going to ask you, so how does a nurse transition into public health? Because as you're telling me, it's not, right now, a lot of it is non-nursing, right? So if I wanted to go into public health, if a nurse wanted to go into public health, what does she need? Does she need any particular special training? Does she need any particular education? How easy is it to transition into public health?
Okay, so usually what we and I recommend, and most people that have been in public health, even though there are some programs that would accept somebody straight out of school. But I always recommend, as I did with my students who have an interest in public health, is to go and get that hospital, experience first, because you're working independently. So you are in the home and you have to be able to make those assessments and make decisions. So you need to be firm. That's why they do not really like to just hire a brand new graduate in public health, because they don't have that experience behind their belt. So that might be a little, even the school health nursing program now, which they're actually asking nurses to have some experience before they get into the school health nurse, because again, you're working independently and you need to be able to make those critical thinking skills. The one thing that also here in Tampa with the school health program, that the director made this decision, and I totally agree with her, is that school health nurses need to be baccalaureate prepared. Because you do not get that critical thinking skills in a diploma program. You need to have those because you have to work independently. And especially these days with what you have everything in the schools. You have G-tubes, you have people on, diabetics, children's diabetes. So all of those things that you have to be able to handle in the schools independently. You don't have a doctor right there that they're not there. They have doctors assigned, but they're not there in the school. So you really have to be able to know what your assessments and what you're looking at, so that you can make decisions. And those critical decisions are important. You have, especially in the schools, when you have kids that come in with you have to be on your toes to be able to know what you're going to do when you're called to a classroom, on the football field, or anywhere in the school that they're going to call the nurse, and you have to be able to make those decisions based on your assessment. So they need to have some hospital experience before they do. In public health, as they try to dwindle away and not hire as much nurses, they find that when you have things like this pandemic, you need nurses. Who's
do.
going to give the shots?
You know,
Who's going to give all the vaccines?
Yeah.
You know, and they end up having to. I remember with H1N1, I was working. I mean, all kinds of hours
I know.
trying to train all the nurses that we had to hire from an agency. I had to train them because some of them never gave vaccines. We have to train them on handling the vaccines. We had to, you know, I did the training. I did the help with, we hired extra people and distribute the vaccines to get them out and to make sure that they're going to keep the vaccine safe.
Mm-hmm.
So we had
Proper
refrigerators
storage.
and the proper handling and storage and the proper techniques. Because you're a nurse doesn't mean that you know how to give a vaccine. And
the record keeping that goes with that.
Mm-hmm. Yeah, some nurses will say, well, I'm give shots. Okay,
yeah, it's not
you're giving vaccines. It's not the same. And they don't realize that until they've had to do it. So whenever we've had to, with public health things like this, they're gonna have to hire, use agencies that hire nursing staff, but you can't just bring them in and expect they're gonna know. So really you have to get them trained.
Yeah,
so
the
during that H1N1,
mm-hmm.
I really did, I worked my butt off, weekends included, that you would have to, and I would get an alert that the refrigerator is out of the temperature range. My phone was on 24/7. So if the refrigerator goes out of range, I'm going to get an alert call.
Yeah.
And then you have to go in and take care of that.
Yeah.
So because public health now has decreased the amount of nurses, they end up having to, when things like this happen, to go ahead and use agency staff. And then it comes down to the nursing department, whoever is there, to make sure that things are done right.
Yeah.
So you can't just hire people and send them off, and then you're gonna get a lot of problems. Okay. So you don't just do that, and you don't assume that they know, because they're a nurse, and nurses are the ones that know best of who are. You get a lot of people that are in management that are not medical people,
non-clinical
management, and they basically are trying to make the decisions. So without having the nursing person there, you're not going to be successful.
Yeah, because someone does not know exactly what it takes to do this job that you want done. That looks like a simple thing on paper.
That looks like a simple thing, and they write it all up, and we all know how that happens, and they haven't considered a lot of things. So you do need to have the nurse in there. And even in there's public health degrees that are public health that are not nurses. So you have public health. People have their masters in public health. My other daughter has a master's in public health. So she does a lot of data analysis, collecting that for different studies, that kind of thing. So you do get public health people that are not nurses from the medical. So they're critical as well. They're used more, especially with the contract tracing and stuff. They're critical. They have that public health training that comes in very handy in cases like a pandemic, and other areas. Those people do a lot of some of the studies that are being done and analyzing the data and making sense of what the data. They explain what the data
making
means.
sense of what it means.
They can tell you what it means. And having had that public health training as a nurse too, that having my master's in public health, I have that piece behind me, even though that's not my forte. That's not what I go after so much, but I understand that. And then you have to
how to interpret the data.
Yes.
So Margaret, what do you do to relax from all of this?
Of all of this,
Yeah.
well, I like to exercise.
Okay.
That's my thing. I before I had retired from the health department, I started an exercise group.
Mm-hmm.
Brought in a trained, licensed, trained, what do you call them? Trainer.
Trainer.
The trainers. And we took lunchtime. So twice a week, one day we will do yoga.
Yeah.
She comes in and teach yoga. And then another day we do kickboxing.
Okay.
And we used to have at the health department like challenges as a health department, and we had teams, and I led a group that we won the first place, and because I'm very competitive, so
no kidding.
always have to. But you had to pay the person because she was a license. But when we brought her in, everybody put in how much we would do for that. But it really keeps you motivated, especially when you have a stressful job. And nursing is stressful. I don't care what area of nursing you're in, it's stressful. And you need an outlet. And exercise is the thing that really helps you to be able to not be overwhelmed by it. When I first came into public health, as a public health nurse in Boston, I burnt myself out because I thought I was coming to really change the world and change people and make them all these resources we have. Come on, your baby can do better, and then they don't follow through. And so you can burn yourself out easily. So you have to have those outlets to be able to be relaxed and be able to function. So exercise and the other part that I love listening to gospel music that helps keep me calm. And that's what I do to relax.
Essential, absolutely essential.
Part of my whole nursing also, I towards the end, as I was getting closer to retirement, I thought of getting the younger nurses that are being trained now, get them, we should pass on what we have learned to those. So that's when I decided to go ahead and teach at the university. So I was an adjunct instructor. I did 2 universities. I had University of Tampa and University of South Florida that I was an adjunct instructor. So I did the public health piece of that. So following them in the clinicals. And one of the things that I tell the students, a lot of them actually enjoyed public health. They actually, I did this for about 5.5 years, and none of the students that I had in my public health classes said they hated that. They really, really enjoyed the public health piece because all they had before that was the hospital piece, the psych, the pediatric, the med surg, all of those things.
And now they're closing the loop.
And now they're closing the loop with getting that public health part of it. And it really made them feel like, oh, wow, there is a lot more to than just the hospital, to looking at a patient, not just in the hospital, you see them once and then they're, but how do they live? What kind of, not everybody lives like you do. So you have to look at the whole person, and it helps them to make better decisions.
Indeed.
So that part I really enjoyed doing that part. Which if you ask me why didn't I do that early in my career, I had no interest really in teaching. It's only as you're getting closer to retirement that you feel like, okay, all this knowledge and all this experience, that you should pass that on to the next, help train the next generation of nurses. So that was my whole interest.
So more power to you with that.
Well, I retired from that now. So I'll do things like this.
Here is the thing, though. We say that, but in we never really retire, because after a while it becomes even if you're not doing it formally, you find
Right.
yourself doing it.
Yes, you do.
You
Your
find yourself
neighbor
doing
who
it.
might ask you a question,
Yeah, you
or
find yourself
even
doing it.
church members that
Yes.
you're always
You always
a
do.
nurse.
Yeah.
So
Yeah.
always helping.
Yeah. So Margaret, thank you so very much for talking to me today. I appreciate your time more than I can tell you. So thank you so much. You have so much to share. I suspect that one of these days I'm going to call you and tap your brain again and say, let's talk about this, that, or the other.
Yes, would love to. I enjoy talking about, as you can see, I
That's
enjoy
true.
talking about your passion. You're passionate about
Yes.
it, so you do. Yeah.
Thank you so
Well,
much.
thank you. You're welcome.
Okay.